translation for it. So is that
Oh, you don't have the translation for it. Okay, let me see if I can have the translation. That's the one that I actually had the very first time. Yeah, I'm sending it to you. Okay, I sent it to you. So I'll add it later after the session, and then inshallah. So I think I'll just start. Let me share my screen, and everybody is hearing me, which is great. Let me see. Share my screen. Thanks, guys, for your patience. Okay. Okay. So today is our 15th session, and we are actually pretty much wrapped up here with all the topics that we needed to discuss with respect to EMPART, with respect to the project PCOR, and the asset mapping, and how we would be running it with respect to the EMPART project. So inshallah, on Saturday, basically we will have the assessment, and we also have meet and greet. So we would like to meet everybody in person. I've met some of you, but I haven't met everyone. And I think we would also want to have a comfort level with each other, because we would have a schedule out. We would also be discussing the outreach schedule or vert reach schedule on Saturday. So. So project activities. So we're actually talking today about project execution, monitor and control, conducting, EMPART, communications management plan, project activities, our outreach, work reach. I don't know if you guys like this word or not. It's virtual outreach. So I'm calling it work reach. So town hall conference, town hall is going to be in March. And part of the reason why we are doing the vert reach is within a specific community, is so that we can prepare for the town hall, and the representatives out there, the healthcare administratives, the accountable care organization in those areas get to know you as a community health researcher. We want them to know you. You want to know them as well, because that's your community. You're helping those people, and you're actually making sort of like, making an impact in that community. So town hall is really a good way to get to know each other. And I don't know, I still don't know yet whether we would be doing the town hall as a virtual event, or it's going to be in person. More than likely, I'm about 80% sure that it's going to be a virtual event, because I think COVID, more than likely, we're really hoping that it would have subsided by then, or at least would be much better situation than we are in now. But because of the cold weather, and because of the inconvenience that people are now, we're all now so used to the vert reaches and so used to virtual environment, that it's much easier and much more productive, which I found out much more productive for us to do it that way. And of course, we actually reach out to a much larger community when we have the vert reaches. So sounds like it would be a better option. But again, we may have a small presence within the mosque as well, because eventually it's the mosque that we wanted to be recognized, and the place that we wanted to be recognized for all their community efforts. So hopefully that way. And then the conference is going to be, inshallah, hybrid. That's what it looks like in June. So close disseminating and adopting. I think I'm going to take this topic actually on Saturday, because adopting the results is actually a much larger topic, and it cannot be completed within 15-20 minutes. So I've dedicated that with Saturday, because that's what we are really doing on Saturday. We are adopting a PCOR, mosque PCOR toolkit. So I would like to memorialize that basically the ending of the training program with the commencement of adoption. I'm excited about Saturday, because it's really the new beginning for all of us, because we would have adopted the PCOR toolkit, and now we're moving forward with that mindset, and would go out in the community to do the birth reach. Okay, Brother Abdurrahman, if you want to present us with the dua, and let's actually intend, guys, that today we are talking about communication. We're also talking about the stakeholders and communicating with the people. And this dua is just this dua is perfect. We actually began with this dua as well. And it so happened that I'm thinking this is the most appropriate dua for today's session.
All right, assalamu alaikum, everyone. So I'm just going to recite this very short dua. Bismillah ar-Rahman ar-Rahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. And the translation goes, O my Lord, open for me my chest, grant me self-confidence, contentment, and boldness, and make my task easy for me, and loosen the knot from my tongue, that they may understand my speech. Ameen, may Allah accept.
Ameen. Okay, so I would like to ask you, I finally adopted your icebreaker technique, Dr. Rebecca. Thank you so much for that.
Oh, that's good, Fatima.
So I want to ask you guys, what's your favorite tool? Anything, whichever, when you're doing something, or when you're starting, or starting on a new thing, or you're basically at home and not enjoying something. What's your favorite tool? And if I can see in the chat. Interesting.
Wooden spoon.
Mr. Do you need to mute yourself? Anybody else? Ah, interesting. Oh, that's funny. Google and internet. Yeah, Google is really oh my God, it is interesting. Very nice. Anybody else? I put mine in there too.
That's a great question, Fatima, because particularly from a point of view of a qualitative researcher, thinking about, it's not just surveys, but it's taking pictures by your phone or cameras and that sort of thing. So yeah, those are all good qualitative tools. And the reason I like a wooden spoon is because I make cakes with wooden spoons, so that's sort of, I associate that with engagement. Actually.
Yeah, absolutely. And it just hit me in the past few days that we are talking about a lot of tools, a toolkit. And in fact, this is if we see around ourselves, I remember about 15 years ago, the buzzword was systems. Everything was a system, and you needed an input and output, and whatever you have, the technique in the middle that's a system right there. And these days, I'm finding out that there are toolkits. There are a lot of them out there for every single thing. So tool is the new buzzword, and every one of us is actually having a favorite tool. And yeah, Google and internet and phone, all of these are extremely good. I think I asked my daughter, she said pen. And I'm like, really?
That's cool.
That's interesting. So I don't know. I got to ask my son, what does he think? But that's go ahead, please.
No. So just a sort of fun question. Which tool does everyone think medical researchers use most? Is it interviews, surveys, focus groups? If you did, yeah, which one do you think?
I gotta know what the chat button says.
Yeah. Those are great. So yes, and so you're all right, because quantitative, surveys, hands down. Interviews are the well, actually, it's a close run thing with focus groups. That's interesting. When you do a search of Medline, PubMed and Medthing, it's focus groups and interviews. But you see, as a qualitative researcher, there are so many other things. And interesting, you talked about phones and cameras, and there's so many fantastic methods.
Yeah, absolutely.
Asset mapping. But yeah, there are all these other things. So yeah, good. That's a great question.
Yeah, it's funny to share. When I asked my daughter, she said pen, and I said, "Oh, I see where you're coming from." She said, "Oh, you were doing what? You were doing a psychoanalysis? You should needed my permission on that." I'm like, okay. So that's what happens. So what's happening around us? What's happening while we're doing this, and what exactly are we trying to do in the sense in our Canvas community sense? So we have the social engine coming around. We're all what we are trying to do in the MOS community is basically we're doing the patient-centered outcomes research engagement project in the MOS community. So what I meant with that question is that exactly what is happening in our community. And what's happening is we're doing a patient-centered outcomes research engagement project in MOS communities. I kind of noticed that pretty much all of us we're on different page with respect to what is happening. So I thought it would be nice to have, in a nutshell, a statement that this is really this EM part is actually a patient-centered outcomes research engagement project. And it's an engagement project in MOS communities. That's what it is, basic. Now, again, every word is loaded, and we're going to look at it and decipher what it is, but that's what's happening. So, and how is it happening? So we have talked about the planning and the basic cycle, the planning of the project, the conducting of the project, and the disseminating of the project. So we are actually, if you look at it, it's an engagement project in the MOS communities, and you say that, okay, it's an engagement project in a MOS community. So we are planning an engagement in the community. we are conducting the engagement in a MOS community, and we are disseminating the engagement or the MOS PCOR toolkit in the MOS community, because you're planning the engagement. Why are you planning the engagement? Because you're trying to figure out how does the MOS communities of stakeholders can get involved with the PCOR, right? So you plan the engagement, you are conducting through asset mapping, you're involving them because that is something that they would like. And then you are letting them know that here is the toolkit that would allow you or give you tools to actually go on and further be engaged with the scientific studies, with the community health, with well-being. There are many benefits or advantages to that, right? So in the planning phase, again, a figure that I borrowed from Dr. Pajelas, you have the details in there, what's happening. It's so what does it do? That this is a PCOR project lifecycle, and who's doing it? So who's conducting this PCOR project lifecycle? Now, this is a collaboration between a PCOR team and the MOS community stakeholder. That's who are the players in this. And there's a MOS community, there's health systems and the assets. So the health systems out there, they are also, I just want to make sure that you understand that those are all part of assets, the hospitals, the physical therapies, the pharmacies, even a cannabis shop is actually an asset in your community, but that's an asset that becomes a liability later on. I don't know if I'm right or not, but people have different views on that, but that's how I look at it. So again, with assets and liability, you actually subtract the liabilities out of assets. So when you know that there's a cannabis shop in this town, you know that you need to bring in even more assets to offset that kind of a negative asset. So anyways, so look at assets and look at community resources, and you can look at it in many different ways and many different terms. So I want you guys to keep your horizons wide open and keep thinking about those. And all of these are parts of our stakeholder team. And then we're there. We're the PCOR research team. So we actually, these three components are really coming together and creating this particular dialogue here. You got the MOS community members, you got the health systems and organizations, and you got the MOS PCOR research team. And then you are right there, the cohort is right there in the middle. And you are literally the ones who's making things happen. Without you, nothing is going anywhere, guys. So if you look at the MOS community members and the research team, there's actually on the side, we are collecting the data. And if you look at the hospital systems and the research team, you look at it and you say that, wow, there's a network that you can establish with all of these assets. And think as it as your own network. So each one of you, when you are out there in the community, you're about to increase your network's worth 1,000 times, because each one of you is going to be, they say that, you tell a good service goes on 10 times, or 10, you tell it to 10 more people, and this is the norm in marketing. So each one of you to 10 of you are there, so you'll really be multiplying that many times. So each one of your network is going to increase quite a bit. And then with the MOS community and the hospital, why would the hospital systems be interested in the MOS community? Because it gives them access. And the MOS community members are also interested in these assets because it gives them access to what they need. So this is a win-win situation for all of the stakeholders that are a part of this particular project. So how do you fulfill your role, right? So we're just going to review some of the things, and we've talked about this: planning, conducting, and disseminating. The 3 PCOR methodologies, basic steps, right? So in planning, in a nutshell, and again, PCOR is what matters to patient. So I'm reviewing these concepts with you guys in a nutshell today. And we are going to tie all of these concepts with how we communicate with the outsiders or the stakeholders. It's important I remember we were talking about yesterday that the language is important. In order for us to communicate, we need to loosen the knot and we need to open our chest. So these very small phrases and a concept in a nutshell allows us to do that, quickly transform a concept from one mind to another mind, or one head to another head. So planning, and it's basically in PCOR terms, it's the topic of interest for patients and caregivers. So what do they want? So when we are talk about planning and engagement, we were thinking from a PCOR, from a patient perspective. What do they want? Why would we engage them? And that is why we are bringing to them a long list of assets so that they can pick and choose. It's up to them, however they want to get engaged with this. Conducting. So what we are doing is with asset mapping, how do we research the topic that benefit the patients? So we are bringing it in the terms where they can understand it. And that's what when we go to actual asset mapping technique, you're going to say that you would be doing that. You would be literally conducting an engagement research phase as you do the asset mapping. And we're at the end of today's session, we will go over some of the very basics as to what is it that the patients want and how we are giving it to them. It's a very small piece, but it makes a huge difference. And disseminating, telling others in the community what matters to the patients and the caregivers. So disseminating is itself like engagement. It's a separate ballgame. And we are going to experience that when we do the town halls, when we do the when we are at the conference. That's what we would be doing. You would be disseminating your VertReach results at the town halls. And at the conference, we're taking your VertReach results. We're also taking the MOSC PCOR toolkit. We're bundling them together with the community needs health assessment results. And we are presenting it to the much larger Muslim community that these are the results over the period of 4 years now, by then, inshallah, that where MOSC community takes with respect to PCOR. So I just want to also reiterate that PCOR, there are two types of PCOR projects. There is an engagement project and there's a clinical research project. By the way, there is a third type of project too, which is called disseminating project. And that is basically adoption for the new technologies. But for our purposes, I'm just keeping it simple and leaving it at two types of projects. I'm not going to delve into the disseminating the healthcare technology aspect of those projects, because those can be much more complicated and then even clinical trials, actually. Anyways, coming back to the engagement project versus the clinical project. So how do we get the buy-in from the MOSC stakeholders? We were right here. We're doing something that matters to patients, right? So we are conducting the VertReach now. We are letting people know that here are the assets, and how do we get the buy-in? Any guesses that you guys have? I want to go back to my chat box here. How do we get people's buy-in when we are doing the VertReach, a virtual outreach? You can talk too, actually. That's fine. Any ideas? No?
Sorry, can you repeat the question again?
So how do you get the people's buy-in? You're doing virtual outreach, and how do you get people's buy-in?
Do you connect with the things that are important to them, like find those things out and present what you're bringing as that thing? Or
Yeah, very good. Very good. Anybody else? Okay. So let's so we communicate, right? Exactly what Javeria said, that you actually ask them what they are interested in, what's there that they can. But we have to do it with clarity. And clarity is actually a pretty big spectrum. And lack of clarity is actually the biggest challenge to engagement. So once again, how do we bring clarity to the words we use? How do we bring clarity to our communications? So the best thing to do is to use a communications model. And I have actually found this model to be extremely useful in everything that I do. From talking to people, a new person, getting a person's buy-in to, changing a person's behavior. This basic communication model, guys, goes far, far. So some of you, I think probably half of you, you must have seen this. I'm very sure about it. The other half, I'm not too sure about it, because when you are focused on a medical field, I don't know that the curriculum has incorporated this so far, but I knew that it was not a part of the medical curriculum. So, but the rest of the half with the health practices or health administration, you probably must have seen it before somewhere. So the basic communication model says that there is a sender and there is a receiver. And so the sender, that the first transmits a message, right? The sender transmits a message, and you see these lines out there. This is the noise. So the noise comes in the middle, and so the message is actually transmitted with the noise. So the decoder is going to primarily decode it for how they receive it. And then it would send the acknowledgement back saying that, yes, they have received it, whatever they have received, right? And then the decoder also becomes, the receiver also encode and sends a feedback message back to the sender, which the sender decodes it then. But again, the sender decodes it with the noise. So it becomes the responsibility of the sender that the message has to be clear and complete when they are sending it. And it is also the responsibility of the sender to make sure that the message is clearly understood. Now, it's not the receiver's responsibility. It's the sender's responsibility to make sure that the message was correctly understood. And definitely there's going to be noise in the middle. And there are all kinds of noises out there, and we're going to see it in a bit. So, and the receiver is responsible for ensuring that the information is received in its entirety, understood correctly, and acknowledged or responded to appropriately, right? So now the receiver is responsible for whatever they're receiving. They're going to send that message back. And whatever they received that they think is the entirety, they need to provide that kind of feedback to the sender so that they know. So there's a sender and a receiver, and there's a noise in the middle. So when we look at it, the reality of the communications is that the noises is actually the media biases. These are the market forces, or lack of trust is another bias, big big bias right out there. There are many biases. There are preconceived notions. There is language barriers, because with language, one word may mean many things. We actually very recently in Worry-Free Community, we as a team, we recognize that how in our community people understand the word may. You know how we say that, oh, you may get this. So when they want to make sure that they want to receive it, they would take may as definitely yes. And in some cases, when they don't want to take it, they would take it as, no, I'm definitely not going to get this. So the word may can be used either way, whichever way that particular receiver wants to perceive. It was a pretty interesting, because we come up with or we get requests to explain the letters to them. And that's how we have recognized that, oh, this question is coming in, or this person is calling for the 10th time because they are misreading the word may, M-A-Y, may. That's it. So pretty interesting how people's preconceived notion can actually get in the middle, and it generates workflow, it generates work or effort for other people. So the sender in the communication model, the sender has actually two choices. They can, because of the biases that are there, because of the media forces, and these choices are there to how to deal with the noise in the middle. That's why these choices are there. And the noise in the, well, yes, there's a choice for the noise, and there's a choice for the stakeholders or for the receiver themselves. So the sender can work on must work with the given reception capacity of the stakeholders. So the stakeholder or the receiver, they are deciphering this message that the sender is sending, and there is a certain capacity that by which these receivers can actually absorb that message, and so the sender has a choice whether they can enhance this capacity, or they can actually modify the message. So they can work with those two things. Sometimes you are not going to find that the capacity is there, so you got to deploy other means, either other means of engagement, or you may have to go back to the drawing board and find out that why the capacity for what you are trying to do is not happening. And the reception of the message depends on the capacity of the receiver. And of course, there are the cultural factors and the biases and options, all of these come in. So not necessarily that what we are trying to do is going to be received the way we are thinking it would be received. So do not get discouraged, because many a times when you start something brand new doing in the community, you're going to be, forced or get these backfires right back at you, and you're saying, what is this? I actually went in with all this good intentions, and now I'm getting this. What is this? It's not the messenger, it's basically the message that's going out and how we're dealing with that. And that is the reality of communications. So when you have so many people and so many forces and so many different types of stakeholders, what are some of our tools that we can work with in order to bring that clarity to the communications? Because every one of this stakeholder group, they have their own preconceived notions, and what they are looking at in a project is not necessarily what you are giving it to them. So how do you, what are some of the tools that you can use to communicate where both of you can be at the same page? Okay, so let's actually review some things as to what are some of the tools that can help us. We know we are running a PCOR project, so which is planning, conducting, and disseminating, and now we're running into a barrier. This is the reason why we want to bring in project management methodologies. One more tool, which is the communications plan, in order to get through this communication barrier. So let's review one more time. In project management, you actually have your initiating, planning, executing, monitor and control, and close. So basically, when you are conducting, and I have this orange, color going all around, you're actually conducting or executing and monitoring and control, and that's where you are deploying this communications plan. Okay. What does initiation do? In that particular phase, you want to make sure that everyone is on the same page of what needs to be done. In the planning phase, you want to make sure that everyone knows what the action plan is and what they need to do when. In executing, you're getting it done. And in monitor and control is basically the extension of execution where you are getting things done properly and accurately. Close is actually one of the very important pieces. It lets everyone knows that things are done. So this is not a continuation. Things are actually done and the project is closed. So these are some of the things where we need to communicate to the stakeholders very clearly and transfer them from one phase to another. Okay. I'm going to move over because there is a thought process that I would go over, and I'll come back to those slides. And Dr. Rebecca will actually be in. Dr. Rebecca, do you want to talk about that particular project at this point?
Yeah, sure.
Yeah.
Yes, I can do
be
that.
A good. Yeah, please.
Okay, yeah. So I wanted to. I was actually on this call this morning, and I wanted to share this with you because it's a nice example of where asset mapping can lead. And this is a project which is being funded by the National Institute of Health. So not PCORI, but very similar. They've learned from PCORI because they've actually asked for a stakeholder engagement plan. And this is the first time the National Institute of Health, and this is lungs, heart and blood. So it's the NILB. I never get those acronyms, but it's basically it's NIH, but it's about heart health. And so they asked for a community engaged stakeholder plan, and they specifically said that they were learning from PCORI. So this is, I thought you would be interested in seeing this one. So this is a 7-year project, which is unusual. Wow. And it's led by a team at Northwestern, but it has actually got a community group, Pastors for PCOR, as one of its principal investigators. So they are actually in the lead. It's not a co-investigator, it's a principal investigator. So there are 3.
Wow, that's nice, mashallah.
It's really nice. It's really nice. So I'm very excited by this because, first of all, because it's 7 years, which is is a long time and means that they're taking their time and do it properly. And secondly, because for the first time, this is the first time that National Institute of Health have actually put a community group in the lead like this. So just wanted to share the aims with you. So the first one is convene community stakeholders in order to adapt the implementation strategies. So basically, what this is about is it's about taking a implementation means they're taking some evidence which has already been tested vigorously. It's actually by Kaiser Permanente in California, and they're going to work with stakeholder group on the south side to see whether or not they can make them relevant. And it's about healthy hearts, and basically particularly reducing high blood pressure. So they're going to work with the communities to basically disseminate, go through that, sort of begin to sort of adapt the materials, then design and evaluate pilot projects, and then test and evaluate a strategy to control hypertension through faith-based organizations in the south side of Chicago. And then they'll look to disseminate the findings more widely to community stakeholders as well. So it's a very focused, community-focused project. But this, I think it's the next slide I thought you might really like. And this is in time of COVID, it's just good. So this is the proposed study area. And I wanted to show you this because you could imagine the same thing with your networks of mosques, I thought. So this is where the researchers have taken data from the Chicago Health Atlas demonstrating higher neighborhood rates of high blood pressure in Chicago South Side neighborhoods. And these estimates are based on behavior risk factor surveillance data, which you know about because of the diagrams, and we've looked at those that behavior data, and basically this shows where the project area is, and then this is it's a close-up of how they're going to work with Access, Alliance Chicago, and these churches all within this area to reduce high blood pressure in Chicago's South Side neighborhood. But I wanted to show you that because I thought it was a lovely example following on from what we'd been looking at, where you identify an issue, you identify an area, and then you see who you can put together to address that issue. Okay, so I think the next slide is just giving you the milestones. So I thought this was useful as well because as Dr. Padella and Fatima have been talking about, the usefulness of an advisory panel or a CAB, Community Advisory Board, the similar sort of thing. The project is called CIRCLE. So that's what that acronym is, and it brings together diversity of stakeholders at the table. And in year one, they're going to convene at least one subgroup to a panel to guide the development and adaptation of interventions to impact hypertension control. And they will define done as at least one stakeholder advisory resource panel meeting, because they have been finding it very hard to hold these meetings during time of COVID as well. And so I thought I wanted to share that too, because I know we've had some discussions about to CAB or not to CAB. And I just wanted to share that everybody is finding this difficult at the moment. And so this project it's going to have an advisory panel, but this is right from the beginning. So this is in time of COVID, so a very difficult time to bring everybody together. And so I think we're very lucky to have Worry Free as a sort of our oversight as our advisory group and support group. And what they're going to do is they're going to conduct an environmental scan, which is an environmental scan of the community-based assets, which includes people, organizations, and associations which will support, influence, and challenge the Chicago aims to reduce hypertension. And they will define that when they've done the environmental scan, which I think is another term for an asset map, really. It's a sort of more of a researchery type of way of describing an asset map. They'll define done as the creation of a living, dynamically updated document which will grow throughout the life of the project. And that's very much what Fatima and the team at Worry Free and yourselves are doing. Only what's really exciting about your work is that you're going to collect resources which are particularly culturally appropriate. And so I could see that if it's a group you're interested in, you have a feel going forwards that high blood pressure, hypertension, and also is something that you as a group were interested in being involved in. I think this might be an opportunity for you to get involved with this project as well. It's a big project. It includes groups on the west side as well, across basically representing all these different diversity of stakeholders. So I'll keep Fatima and everybody up to date with what's happening, but I think this is an exciting project that could have a really big impact on heart health in Chicago.
Yeah, definitely that needs to bring in control. In fact, Jimmy's area out there, Noblest and the 65th and Kedzie, or the I believe that's what it is, 65th and Kedzie. That's where the Noblest is at, the mosque. It's a very small mosque, but the community has about 5 different mosques in the area, and there is a major problem out there with both hypertension and diabetes in that community. So Sister Ganiat, who work as a Chicago Department of Public Health nurse as well, she is trying her level best to help people out there. So that would be perfect. It would meet very well. Very nice. So that's that's some of the things that we need to do, and how do it becomes very important. And so so the stakeholders and the communications plan actually merge together. They toggle back and forth between planning and the planning, the engagement, and conducting. So the communication plan really takes forward the stakeholder management plan. That's how it works. But see how project management is actually really define these very terms by which you can walk the walk that Picori is asking you to. And that's what I really like about this whole methodology. So project management said that when you are planning the communication, or when you are doing a communications management plan, you have three things in there. You plan, and you manage, and you control. So what you do with all of these plans, yesterday we saw that too, that I should have had yesterday's slide in there too. We were managing the stakeholder management through social engine, and literally the managing the social engine becomes the planning of the communications management plan. So now in the plan, we put the social engine as a piece of planning it, how we are managing the communications. So social engine is there, where the stakeholders who are tagged with you, they are going to converse and communicate, but they are going to be managed also through the wider social media, the newsletter, the emails, the announcement that goes out, and the meetings that we're going to have throughout so hopefully either the Saturday or then in the next meeting, we would have a meeting, a schedule in place, where we are doing a stakeholder meetings once a month after the kickoff meeting, which is happening on Sunday, November the 1st. And then every month, at least once a month, we will have a smaller group of stakeholder meetings, which would discuss and would take some of the basic findings or allow the expansion of the engagement primarily, and letting us know how we are doing with the feedback, providing us the feedback in terms of the community assessments and the needs that are out there with respect to different MOS communities. And then in the control, we actually have the stakeholder register that we would be working with, and I will show you guys some of these resources now. So you have the link for the EMPART CHW folder on the Google Drive. So we have put together a basic folder in the Worry Free Communities domain, and it's residing out there. And every one of you is shared for this particular folder. I'm putting out there many resources, but I'm also putting these resources and putting the link out there on the social engine for most of them. So if you go to the shared with me, it's going to be there. And from there, you actually would then go to project documents. So within the project documents, I actually have the Excel sheets and the Google documents, which could be PowerPoint, it could be Google Doc, it could be Excel, Google Sheets, that's what it is. And all of those project documents are going to be in the project document sections. There's meeting minutes, there's slide presentations, there are agendas, there's CHW session recordings, a small video for sign in, My Health, My Responsibility. I believe we posted the video on the social engine too. So how would you sign in to the social engine? Okay. And there are some other documents. Now, in that document, in that EMPART, in the project documents, you have two sheets that I'm sharing with you, and we're going to go there. And what is next? Okay, so let me actually walk with you to the EMPART basics now. So I'm going to move over to my drive where we would have, so over in that EMPART basics, it's a Google sheet, and this is our stakeholder register. So over here we have the CHWs, ours. This is everybody's email addresses and their phone numbers are there. And if I have a profile, we have yeses there. I believe everybody's profile is there. I have a couple people whose profiles are not there. So Masood is gonna work with you guys. And the designated community, I've assigned some of you because of the proximity that you are in, if you are within that community, but there are some that are basically open. So we'll talk about that. Both Bolingbrook Mosque and ISNS, the Rolling Meadows Mosque, are actually open. I don't have anybody assigned to those communities yet. So we have in the stakeholder register, how it goes is you got the PCOR stakeholder category. So if it's a research project team, it's a clinician, it's a patient or a caregiver, and it is an advocacy organization. Is it it's a research, it's a health system. Who do I have? So basically, I've got all different kinds, caregiver category. So I have different categories here, and you can also have a lot more. So pretty much all of these folks in the different, as you come across with the stakeholders in the mosque, you're going to be adding them on here to this register. Now, you will put their names in there. These people will also be, and let them know that you are putting them down as a stakeholder register. By the way, we do have a small form that we would have them signed, or they can, and once they actually sign into the engine and become a part of the stakeholder group, I'll show you that on the social engine right now. They become a part of the group. They are accepting the terms and conditions, by the way. So they are giving us the permission to share their names, or have them be a part of this particular project. And then we have the engaged research partner, the level of engagement. Hang on for that thought for a second. The stakeholder organization, if they're a part of a particular organization, or are they coming in from directly to you as a general body, without any organization, you would find some people who would not be representing any organization. They are simply from the community. That's it. So you would put down the affiliated organization there, and then connections established by. So whoever establishes that connection, for example, these connections have been established by me. So I put my name there. This is Masood Iqbal. So we put his name there. So we know that this is your connection, or you're bringing it in, or you are connected to them by the first degree, or the second degree, or the third degree, those kind of things. So it comes to, so we know who to go to if we need to talk to this particular person, because you are the first connection with them. Now, the stakeholder role. Some of these people are going to be, for example, I have a role here. Dr. Rebecca is a researcher. I also have Dr. Paris David, Dr. Diana Ingram from the Pastors for PCOR team. So again, they are stakeholders in the sense that they want to know what's going on. They are interested. Their power or their interest may not be too high, but their interest may be low. Their power may be low, but they are definitely I would think that both Dr. Paris Davis and Diana Ingram are actually involved. So 1, 2, 3 is the rating. Let me show you where that rating is coming from. So over here is the stakeholder prioritization grid. Now, this is something that we use in project management all the time. And this particular grid, 1, 2, 3, and 4. So it doesn't mean that 4 is the maximum. It just means that 4 comes right out here at which quadrant it's in. So you got, when you use it a couple times, you'll memorize it. So basically, when you have number 1, this is power is high, but the interest is low. And you have number 2, the power is also high and the interest is also high. At the third level, and if I actually assign these numbers, if you guys think that if you assign a different numeric system to this, you can do that too. And we can just go back to the stakeholder register and reassign these numbers. So that's what I thought, that 1, 2, 3, 4 would work the best. That's why I assigned these numbers. Or you can simply say that keep satisfied, manage closely, monitor, and keep informed. You can actually, number 1, you can say that keep satisfied. You don't have to do a numbering system there. Whatever you guys decide, and we have some time. So Saturday we'll probably finalize this. So think through this, and how do you want to use the stakeholder prioritization grid, and then you would be. So the whole idea here is that every stakeholder, because of their power and because of their interest, they actually leverage some form of influence on the project. There are some people, you would find some people where you need to keep them happy, especially some of the board members in the communities where you are serving. They want to know what came out of your project. They want to know how many people in their mosque community were interested, how many people really seeked help, or how many of them do need help. They want to know that. So those are the people who you want to keep informed. You need to some people need to manage them closely. There is when you have a power high but interest low, you need to keep them satisfied. Some of them manage closely, some of them you need to monitor, some of them you need to keep informed. So and these are some of and basically project management really this is a standard practice, by the way, in the industry, that these are some of the tools, again, you use to make sure that every stakeholder has a specific criteria that they are looking forward to from or expectation that they ask from the project team, and they are looking for it. They expect this from us, and that's how we are going to give it to them. When you have people who need to be keep informed, you need to make sure that those people are on the newsletter, they're on the posters, they're on the flyers, they're on the website, program emails, they are there with all the communication that's coming out from this project. It needs to go to them. The people who you are monitoring, they don't want to be informed. You basically need to monitor them. They would be plugging in when they feel there is a need for it. For example, let's say we have Dr. Padela has a person, or Dr. Padela's IAM's a board secretary. I need to monitor her. Her power is low, her interest is low, but she definitely needs to be monitored, because if she needs something, I need to give it to her. And I need so if I see a message from Sundus, I got to know that I need to attend to this pretty much, on top of it. There are certain stakeholders that I need to keep satisfied, and the ones that you need to keep satisfied is you want to leverage your existing meetings, you want to be presentations, you want to make sure that they are in the presentations, the organizational briefings, which could be meeting minutes, which could be kickoff. Probably we would have a small report coming out from the kickoff meeting, those kind of things, and then the timeline, the project plan, and the different reports that comes out from the town halls. So all of those kind of things you need to make sure that you send to those stakeholders that must be satisfied. And the ones that you need to manage closely, these are the people who you need to have them on your phone dial. You will find some of these people that are in this category, which the power is high and the interest is high. These are the people you really become part of your team, and these stakeholders are the ones that can raise an issue, and you can resolve an issue with them, and they would be helpful to accomplishing your project. So it's out there. Make use of it. Get used to it. This is one of the beautiful tools that I've ever come across with. And I use it not just in projects, but I use it in my personal life too. So you kind of rate all of your stakeholders around you and say that, this is who you need to manage closely. This is you need to keep satisfied. This is where you need to keep informed. And these are the ones you need to monitor. It works very well. Going back to the stakeholder register, because this is where we keep track of all of our stakeholders, no matter which community they are from. You would see that the stakeholder organizations, I've got Muslim Association of Bolingbrook, got Muslim Community Center, the MCC, you got the Humanitarian Relief Foundation, HRF, that's out there in Palos Hills. Or Palos Heights, Muslim Society Inc. This is by our mosque, or by our mosque, by our office. Mosque Foundation, you have, this is in Bridgeview. So all of these, we will add the addresses, connection established, stakeholder role, priority level, and then the contact email. You got the phone number. You gotta have the preferred contact method. So not everybody wants to be called or emailed. Sometimes you need to call them. Sometimes some of them you need to call, some of them you need to email, and some of them you need to text. So been contacted. So you may identify them, but not necessarily you have contacted them as well. Because I know there are, or some pretty much many of the stakeholders within all the communities, I have contacted them, but not necessarily you have contacted them. So you being as part of the active member in that community now. So, and then of course your date of contact, you want to put those in as well, but the things that are going on for too long, you're not going to remember that. For example, I've been talking to most of these people since January. So they have been contacted, but it's irrelevant, because if for 2 months I don't talk to them, out of sight, out of mind. So that's why I'm not putting any dates in there. But from perhaps going forward from the last week of October all the way up until March, April, you want to make sure that any new stakeholder that comes in, you do want to put the date of contact in there, so we know how recent of a contact that is, because if there is no date, which means that contact is not recent. Okay. So that's a stakeholder register. We all can see how this is happening, because not everybody is going to be on the social engine, guys. So we want to make sure that we capture the addresses, we capture the emails, so we can keep them informed. They're stakeholders, so they at least need to be kept informed. So stakeholder issues log, I just have a sheet. I don't know. Right now, I'm just as this blank slate right now. So I'm going to need your help in order to populate this sheet as to which format this should be. What kind of logs are we looking for? What kind of things do we need to capture? What are we capturing? So we can decide this as we go as a team. Here's a timeline, what's happening in what month. We are laying it out, and evaluation metrics. So pretty much everything that you need to know about this particular project is going to be on here. Again, read through the evaluation indicators, because these are pretty important as we move forward. And we are going to be, we all of us would actually be filling out most of these evaluation indicators. And once again, we want to capture them electronically through the social engine. But for example, number of stakeholders at the end of the project, that we actually measure it by the stakeholder register. So right now I have some gaps here, but I have about 10-20% gaps. So I want to say about 70 people or 80 people on here. Okay. And then folks that were provided health education during the outreach time. Again, some of these are, you would be doing it online, so we want to know how to capture those. And once you start working with or testing the social engine, we need to populate this sheet as well, because we want to know that what mode, survey listed, number of people in the list serve. I want to see which one was that, number of folks, the stakeholder, where did that go? I just did it. Stakeholder signing, number of stakeholders in the project, name of people in the list serve, or / stakeholder register. Okay, so you want to keep all of these sheets up as updated as possible. number of sponsors for the town hall session. So we are looking for the number of sponsors. The reason why first we wanted, since everything was going to be in person, it was important to have the sponsor. However, I still want to have the sponsors for the town hall session, because that will tell us how much interest is out there, or appetite that's out there among the for-profit industry for these kind of projects, research projects. That is actually a very good indicator of your success as a researcher and as a community health liaison or worker, whatever capacity you are going to be working with community. So if we do have sponsors that are coming forward and they are sponsoring our town hall sessions, it lends to our success, and it also lends to the credibility that if we go on with another project in the community, we will have their support. Because if somebody is sponsoring you with any dollar amount, definitely they're going to be interested in knowing when you are doing another project again. So I would definitely say that it's not because of the money, whatever it may be, $30 or $50 that they can sponsor, but that tells us that this person is actually really interested, because people put their money where their mouth is. So it shows their commitment. Okay, going back to our session here. Where was I? Okay, so we went through the stakeholder grid, the communications plan, and this is how we would manage the stakeholders. So moving forward, you saw the EMPART basics, and we have seen that, and so now that comes back to assessing the mosque community needs. You now have the mosques, and you now have the people you are meeting, the stakeholders. What I would personally do is take when we assign everybody here, I would actually I will informally introduce you to the mosque, and you probably know the mosque people as well. So by all means, take an initiative, send out a project communications to them. You may come up with something. I don't know if everybody got the save the date email. I sent it out to some people, especially the mosque leaders, but I don't remember if I sent it out to everyone. But that's the save the date, and you can actually send it out to them, letting them know that the kickoff is coming in. Would you like to come? Would you like to be a part of that? I believe we have about 250 capacity from one of our sources. I know Google gives us 100, but we also have another platform. We have a 250 capacity, so we can go up to that. But but people are showing interest from the communities that are not this community at all. For example, the Community Engagement Advisory Board at UIC, this email went out to them, and many people from that list is actually interested in joining the kickoff. So they are not direct stakeholders. They are part of community stakeholders in the sense that they're out there, but in their interest and power, they're very, very low. However, I would like to support or would maximize the attendance for the people that are within these communities. I would be surprised if we get more than 50, but I don't want to restrict anybody from attending this that really needs to attend. So make sure that you send out that save the date email as well, and whoever is in your mosque communities or in your social network and social media should be attending this. They actually should attend the kickoff, because we will be explaining the patient-centeredness to them, and we would also be soliciting the people, the community resource, and making sure that we add them to our resource list as well, because after all, they are serving this community, so they can get benefit, and the mosque community patient and stakeholders can benefit from their presence as well. Okay, so I've actually assigned Andy, and I'm not sure about JJ, Jimmy. I'm thinking both Northside Chicago, that's MCC, and the Noblest. So these two I've assigned to both of these folks because they're out there from the city. ISNS, I don't have anybody that's assigned. I've got 4 names here because the 4 of you are not assigned to any particular community as yet. MSI, I know Abdurrahman Behri actually lives right around there. He goes to the mosque. That's his community mosque, and he has told me so. I believe I spoke to Mehreen. No, Mehreen wants to be MSI, I believe, because I saw that in the sheet. So I probably need to make that change. And then Shama and Meher and Asna, I'm not too sure about which mosque do you want to be assigned. Now, this is your primary mosque just because you would be collecting, you would get to know those board members, you'll get to know the mosque stakeholders, the internal stakeholders and the external stakeholders. So for a point of, so we consider for the project purposes, we consider you as a point of contact, and you would also be doing the mosque town hall in that mosque, even though that's virtual, but you're actually engaging the area leaders, area health leaders, and the representatives and the government leaders from that area. So, for example, if we do it at for the MSI Mosque, Glendale Heights Mosque, I would like to get the mayor of Glendale Heights involved in be at the kickoff. We want her to be at the kickoff, actually. We want I don't know which ones have mayors, and probably all of the city mayors should be part of the kickoff, because this is a project that's happening in their community, and they need to know how their community is doing and what assets they are bringing in to the local area. And this, since this is online, it can help out anybody. Okay, so need versus asset. So asset, need meets asset. And again, on the social engine, we actually, which one is that? Okay, so let me tune you back in here. This is the, okay. So if I go to the community's website, let me refresh this. I'm already on here, and here I have assets right there. So this tab is just added today, and he's still working on it. Now, a couple things, you see this, these particular icons that are there, these are basically, we have not uploaded any file into this map. But what we will do is this up the top part that you're looking at, new place admin only. So this would primarily be secured for you guys. So if you find a place and if you need to add an asset, you actually put the name of the place, you add it, and the types, this labels may change. More than likely they will change, because this is what we need to decide on as a group, and the place group. So add a new place, so it will add a new place to it. Okay, and the search function is actually a public function, and so anybody who is actually coming in from the community, they would simply look at this, and they can search here. They can put whatever they need to be. This can search here and put the type, or if they don't have the name, they can put the filters, the place type, and they can search what comes up. So whatever is in our database, which is culturally appropriate mosque community resources, those are going to be showing up on here. So it's definitely not everything. These are tailored resources that are primarily for the communities that we are working with. So things have become much easier, but that's what we did. We actually took the in-person resources, and we put it towards the online resources. Okay, now in the groups, when you go in, I just want to also make sure that we actually are clearing up quite a bit. This is a technical support group. If you have a particular question, you can go to the technical support group and actually post a comment or a question there. And Mohammed Usman, he is actually the owner of this group, and he would be responding or looking at it, because if there are technical issues coming in, he's our technical support guy. who's developing the engine and moving this. So this is our group. This is, by the way, this group is primarily for our purpose. This is not a public group. So all of our communication is very secured, and it is restricted just to these group officers, and all of you can actually freely communicate to each other. You can even send a private message to each other, and so we open this up as a Facebook, basically. So it is, in a true sense, it is it is a group where you can communicate. Now, I do need some help, because I'm not technically savvy, in the sense that I'm not a social media or these kind of social engine person. So I don't know them. When it comes to pictures, graphics, I'm completely lost. So, upload a cover photo, choose from the albums. This is the best I could get. If you have other things, or the colors that we want to choose, or we want to use this particular space in any shape or form, we can. This is space we can actually even eliminate this space if we need to, and just have this particular banner up on the top, so we get more screen space. So use it. We have all of these things are there. The events are there. There's a calendar, which any of you would post an event, it is actually going to show up here. You can go on and post on the blogs. This is where I have actually intended to put all of the session, not the videos, but the session. No, I'm putting it actually on the links, I believe. Or maybe I can put the presentations here. The polls, we can actually do the polls here. You can add a poll, but it's basically, don't consider this as an actual survey. It's actually a poll. If we need to do a survey, we can create a survey form on the Google and post the link out there. That would be a better than polling, but you can do polls for small questionnaires. Photos, whatever photos we need to upload, we can upload it, and everybody on this particular group will be able to see that. Here's where we are putting down the videos. The videos are pretty large, so we're struggling with the space right now. I don't know if any of you have any suggestions as to how we can use the videos and where we can upload the videos. By all means, do it. Somebody told us to get a YouTube account and post it there and put a link out there. So there are all these different means, but any of you would have a better way of running these, please come forward, and then you can run it. We have no problems. And in fact, we're all we're doing this together, so we're a team. It's a team effort. So once I get these basic infrastructure is there, you guys can take care of it, and I would only intervene or let me if you need me. And again, discussions, we can post a topic, we can discuss things out here. For example, there is a particular stakeholder types, or this is a particular asset that we need to add. All of those things can be discussed here. So this is the Google Drive link that I put it out there. Yeah, I did. So if you click, it should take you to the CMPart, to the CHW EMPart. Yeah, it actually takes you to the slide presentations folder. Okay, and so where was I? Social engine. Lost my space there. Okay, anyways, so this is where I was. So that's the link, and then the members, you can see everybody's, you can actually, you're not going to see remove member because I'm the owner of the group, so I have that privilege. Nobody else actually has that privilege. So you can be rest assured that, if anything that you need to know, you need to do, you can talk to me on that. So everybody's an officer. You all have pretty much the same privileges. In fact, I do too. But that's what it is for now. And this, now the top menu bar right out here is at the global level. So these blogs and the blogs that are in the groups are two different places. So the blogs that I have here are actually more general, and this is viewed by everybody that's out there in the community. These are actually training sessions that we posted, and it's being posted at the blog level and the video level as well. So we're working through some of those issues. Albums, this is a good place where you can actually post photos, and so event photos or any other pictures that we want to exchange in terms of infographics, they can actually reside here too. Okay, so that's that for the assets. And that's what, so we have, oh, yes. So I want to go back to the social engine. So asset mapping. So let me go back here to the, so there is a sheet out there on the CHW, EMPART CHW folder called, this folder. You got project documents. In the project documents, you got EMPART basics and asset maps. So I am on the asset maps right now. And there are certain sheets in the asset map. And this is what you are populating when you come across with an asset. And so what we can do right now, we can give a sheet to, we can do some basic entries here that Usman can upload directly into the system all at once. So, and I need, we're doing this sheet just for the introductory period. On an ongoing basis, you would actually go to the map itself and you're going to type up here. But just for the introductory time period, there are many questions when it's coming to assets. What is the type of assets? What is it that we want to map? How do we know that this is a good asset? So there are many questions that's coming up. And Dr. Rebecca's session 5 and 6, I believe, those provide a lot of useful information. So I would highly recommend for you guys to review her presentations. They are available online, as well as there are videos in there. So you can review the slides quickly, or you can listen to the whole presentation again to see what are some of the things that are important in asset mapping. So the resource data over here, we have the stakeholder type. We're capturing that as per PCORI. We have the resource name, the date entered, the repository. This would actually be entered automatically, so don't worry about this particular one. The resource, or you can put it there and it would be overwritten when it gets to the system. The resource description. So this resource description comes in for what you do. For example, we are a community health social services organization. Why do I have several of these entries for my organization, right? So the reason why I'm having, and I'm still struggling, I was talking to Usman about this too, that, and I'm sure some of you would have a better idea. I have a primary resource category and I have a subcategory here. I'll tell you where these are coming from. So the programs that my organization run is Medicaid, Medicare, ACA, Marketplace, county plans like Access DuPage or Next Level Plan or County Care for DuPage for Cook County, and then there's a free clinic. There's a financial assistance program that we run. There's a Zakat program. There's an immigration paperwork. So we also have a program for that, and tax assistance in the sense that we have some people want to know about how to do something, or maybe they are falling short on their premium tax credit. So they ask us for a loan. So we have a financial assistance program, financial family assistance FFA program that we run. And there's a small some amount of money that we have dedicated, and actually Imana has sponsored that program for this year, and so we have a small pool of money that we help out with the community members when they run into the premium tax credit issues with the ACA. So we do that. There's this these are the addresses, and have the resource website, resource email, and you have the languages and the phone number there. Okay, so these are the basic information, like a demographics for the asset. Now, this is Usman there. He's doing that copy of the resource. He's doing something. This is the sheet that I want to talk to you guys about. And I know it's going to be not, you would need to think through this. And we're looking for answers on Saturday for sure. So the blue section, the blue stuff that you see is actually coming from, let me see if I have that slide here. No, I don't have that slide. Let me open that up. From yesterday's session. So this particular slide okay. So this is the particular slide. So you see the health behaviors, clinical care, social and economic factors, and physical environment. So this is a category we're mapping, and we are also mapping this particular category with the different primary categories or primary types, which is tobacco use, diet and exercise, alcohol, because we want to see how many people are needed in what kind of categories. So these are the stakeholders right here. So when you go back to EM Part Basic, this particular one in the resource data, your stakeholder types matches your slide right here. Okay, this particular stakeholder type. When you go to the resource category at this page, the blue, the health factor, social and economic, or no, not the health, the social and economic, physical environment, clinical and health behaviors actually map to right here, health behaviors, clinical care, social and economic, and physical environment, right? So this is how this is being mapped. So all of these are actually social and economic. So these in the green, this is your primary category: a caregiver, community contacts, employment and income, advocacy, legal, veterans. Now we want to know here we have about 5 of these categories, but there are more that exist, and we need to come to terms in how many different categories that each health factors come out to be. And that's how we are going to map our resources right here in the categories. So you see that the primary resource category, access to care and clinical care and income, they are actually being mapped right here, right? So on the EM part, on the resource category, they are being mapped right here in the green. Okay. And here what you have is adult daycare, respite care, caregiver support. These are the actual services that any nonprofit organization or your assets will be providing. So this is the data that is being plotted at the government level, right? The green data. The black data is actually the one that are the services that being provided at the by the community-based organization. And people ask for these services. They're not going to ask for clinical care, or they're not going to ask for access to care. They come in and ask for Medicaid. They come in and ask for Medicare or health insurance. That's what they ask for. They don't ask for access to care. But NIH or PCORI map How much is the problem with access to care? So we want to collect these data points. That's what we want to do. We are letting the system collect these data points. So the only way the system is going to do that when we map every asset to each of these categories, right? And that's the tricky part. So this is the researcher in you guys. So we want to know how these and Nabil actually has put together this particular thank you, Nabil, particular page, and he's also refining it. But we want to come to consensus on this. How many categories or different categories does social and economic factor represent? Does it represent 7? Does it represent 10? How many of these come in? And then you can decide on the services. So every asset that we have in the community is then going to be mapped to a category here, and then they're all and the category backend is mapped directly to the health factor. And in March and in April and also in June, we want to see how many people did ask for caregiver support, or how many people came in and asked for employment and income. And we can see that, this, for example, a particular mosque community asked for advocacy, and such mosque community asked for legal help. So that's how we are going to know what the community need is. And it is actually, you're letting the computer system work for you. So all we have to do is set this up, and we're going to do this together because you guys are the experts here. We have a clinical end. We have got people who are, from the medical background. We have people from the health administration background. And I think between these two groups, I think we have it all. Alhamdulillah. So this would be a wonderful experiment when we map these things in. So look at this between now and Saturday. And Saturday, we are going to discuss this in detail as to what categories are going to go where. And this is really where we have started to adopt the PCOR methodology. And we're going to talk about dissemination, implementation, and adoption of PCOR, inshallah, on Saturday. Okay. One last thing I have is this. So this is the program development. I'm actually looking. So when people search, they put the search tags in. And this is some of the search tag that I have come up with. I would when I want you to do the primary category, or the subcategory is basically, the subcategory is actually a service or a program. That's what it is. And this subcategory it actually is then linked to a particular health factor. Now, what we have done is we have said that each health factor is going to have a particular icon. By the way, these are the health factors, right? And these are the primary categories. So because these are the categories which is the data is being collected, or the health disparities. And then this is where this is the clinical care. And then now the reason why this is important is when we look at this, you see this icon right here. So every icon is going to be different, or we're going to have maybe like, I want to see how many different icons here. So clinical care, socioeconomic factors. So if we go to this particular one, so 4 different icons, that's what we are going to have. So we want to know how we can do the 4. Well, think through it, because I think in socioeconomic there is income and there's food pantries. They both go in socioeconomic. So for food pantries, I want to have a different icon than I want to have for income. Definitely, if I'm searching for it, because if I search for a food pantry. Well, it would work both ways, actually. So I don't know if we need more than 4 icons, but that's what we need to decide as a team. So I'm actually neutral on any of these. So we can all, I'm sure that with your feedback, we would be in better shape. Okay, so that's what this is. And going back right up here, is this my 14? No, this is it. So these are the things to do: list of categories, subcategories, list of stakeholder types, icon identification, and flaticon.com is the place. So what you do is when you like an icon, you are going to actually put it right there. This is the icon link. So if I click on this, it's going to take me to this particular icon. So that's the one that I selected for one of the services. Okay, but we are putting this link icon right here, so we know, we let the programmer know which icon he's mapping to this particular asset. And we don't want too many icons. We probably want to have 5 or perhaps 10, but no more than 10 icons, I think. So there would be some duplication, maybe in the primary category. The primary category may have icons related to it rather than health factors, because there are 4 icons in health factors, and right now I have 13 categories in access in the primary category. So, but please do think through this seriously, and we will discuss this on Saturday. So, I ran out of time, and I'm not gonna. I'll cover this one on Saturday as well. So there are the PCOR methodology. Once we go back here with the engagement components, we were talking about that we are mapping all of these with respect to what makes sense to the stakeholders. And on Saturday, we will pick up from there. Why are we mapping some of the things versus the other? Because we are picking up those assets that people are interested in. So it's patient-centeredness. We are bringing that in. So I want to make sure that we review the patient-centered approach between engagement projects and clinical projects. And we want to make sure that our asset mapping satisfies both of these 2 standards of the PCOR methodology. And this is also an adoption of the methodology aspect, actually. So it would be good to have it on Saturday. Okay. So we will see you guys on Saturday, October 24th, inshallah, at 1 p.m. And I'm hoping to see most of you in person, almost all of you in person. Any questions?
Assalamu alaikum. I have a question.
Mm-hmm.
In terms of when inputting the stakeholders data, like patients will be more than like the other types of stakeholders, and caregivers include that. Do we want to like include them in the same like Google sheet, or do you want?
Okay, good question. Very good question. So basically, when you are conversing with the patients, you are on the social engine. Social engine will have it has a chat feature, and that's what the programmer is putting in now. Hopefully more than likely the chat feature will be available on Saturday. Not sure, but definitely the assets will be available. So we would need to have the chat feature possibly by early next week, as well as a phone number. So you are conversing with them online. Right? So the data is being captured in the social engine because what they are putting in. You don't have to put in there is an intake form that's going in, and that's where you can fill in their information, but it's happening in social engine. You don't have to map it on the stakeholder register, because the stakeholder register is something we want to keep, unless these are the patient researcher. So I do have a couple patient researcher for the EMPART study that I spoke to them, and I told them that we want them to be at the stakeholder meetings. We want them to be at the kickoff so that we get their input. So they already have the buy-in, and they are our patient stakeholders, and that's why they are on the stakeholders. But and you probably have other patients who want to be a part of the kickoff meeting, or who want to be a part of the stakeholder meetings. By all means, those are if they are patient researchers, then they should go on the stakeholders. Okay.
Okay, thank you.
You're welcome. Good question. Very good question. Anybody else? Oh, I'll be sending an invitation out for Saturday. It will have the address on it. Okay. Okay, Jimmy. Thank you. Looking forward to having you out there. Okay. So there are certain things that are subsidies, incentives, sort of difficult online through. It's sort of difficult online though. Incentives. What do you mean by incentives, Mehreen? Is disseminating in PCOR project as part of monitor and control? Oh, good question. Yes, no, it actually overlaps with monitor and control, but it's the part of close. Close in project management is a very small process. Very often it's a small process, but disseminating really in PCORI terms, it's a very large aspect, and it encompasses many sub steps in it. So we are borrowing that from it. Okay, Masood, you want to make sure that when you send out the invite for Saturday, it should have the complete address on there and also the opening direction. So we normally keep the door locked for our office because of COVID, but we will probably have it open at that time. But if whoever comes in first, if they find it locked, so please stay there for a couple minutes, because we have a split level. So either people are upstairs or they're downstairs, and somebody would come and run out and open the door for you. Okay. Any other question, guys?
So when we go out in the field and like start engaging with the stakeholders, are we gonna like focus on like patients first, or like we're gonna do simultaneously patients and like other types of stakeholders like
Very good. You're thinking through this, huh?
I'm kind of still confused about like what exactly we're going to be doing.
Yeah. So actually, what I had at the end of today's session is the elevator pitch, because it's important for us to have a 20-second or a 10-second tagline. And what we are doing, I told you guys. So what we are doing today is this is a patient-centered outcomes research project, and this is an engagement project. So we are engaging the community in the community needs assessment, right? So this is the pitch, and you would say that this is who you are, and that's what you're doing, and you were also engaging people who represent a resource in the community, and that's your asset. So do they like to do they like to go on the map? Do they want us to be? Would they collaborate with us to go on the map? And I was actually thinking that we probably, I don't know if it would be too much if we are asking them to sign an agreement or something. Should we be doing that? Should we not be doing that? It's open for everybody. Again, these are the questions for you guys. So you would be talking to both kinds of people. You're talking to patients, you're talking to researchers, you're talking to the assets, and whoever you come across with, you would talk to them accordingly if either you are going to be using them as a resource, or you're actually you're referring them a resource, basically, or a patient, right? So this exchange is constantly going on, and either way, this information is going on one or the other place. There are two basic places where the information is holding. One of them, it's going into the social engine, and then if it's not going into the social engine, that you're going to put in as an asset, or you're going to be putting in in the stakeholder register. Is it clear, Asim, or no?
Yeah, it's getting clearer every time.
Okay. And again, you're actually sitting online when you're doing the VertReach. So you're looking at the inbound traffic of if the questions are coming in on the online. If the questions are not coming in, or you're not talking to anybody, then you can possibly be doing an outreach, in the sense that you probably you'd be looking up the resources, or you have a previous question that somebody wanted to know if there's a pharmacy that can give them free flu vaccine. So you want to look up online, saying that if there is a resource out there and a vaccine can come in, doesn't have to be again, depending upon what kind of vaccine it is, and whether it's culturally appropriate or not, you would say that, oh, this is something that is commonly accepted. If there are questions that we are getting into the bioethics issues, we have Dr. Padilla. We can always send that out for him, and let him answer that for now. Otherwise, it should be it should be a committee that should be sitting out and saying that, yes, this is what's permissible, or this is what we would put it out there on our, and that should be the patient-centered outreach. That's a CAB. That those should be the people who would be making these kind of decisions eventually, if it goes to that route. But right now we have him, and then you're actually putting it online and searching things online and putting it into the assets. So the assets are getting populated every day that you guys are supporting the community. So yours is a Bridgeview, and it's actually Humanitarian Relief Foundation. So they have asked us to be there in person, and they have a very small group, and it's a pretty large space. So social distancing is very, very easy in that space, by the way. So you don't have to worry about it. And it's not a mosque, it's a community-based organization, but there are many community members from different mosques that actually come to that. So in a sense, it supports a community. It supports the mosque environment. So I believe my staff is scheduled to go there on Wednesday, and then Worry-Free Community, we would probably be out there every Wednesday during the open enrollment, which is November 1st through December 15th. So, and you can be out there too, with the Worry-Free people. So you get to know and you get to learn, and there's a lot more. These are 6 exciting weeks coming up from November 1st through December 15th, because there's a lot of calls and there's a lot of people asking the questions. Okay, any other question? Mehreen, do you want to explain what you mean by incentives, or you have a question mark?
Oh, I think you had asked a question earlier, and that was like my response to it. I wasn't sure you asked. Yeah.
Oh, okay. I see. That's right. What makes them interested?
Yeah.
Yeah, incentives. It depends what kind of incentives they are, right?
Yeah, I wasn't sure. That's why, because it's online, so I
Yeah. Okay. I didn't see the times there. Yeah. Anything else? Okay, then I will see, inshallah, as many people as possible on Saturday.